Hello everyone, good morning. I am Sanya, your host for today's live from All About Skin Wellbeing team, and I'm sure all of you must be keeping good health. Today we are going to discuss about our skin healthy with focus on urticaria or hives, which we for our near and dear ones would have encountered at some time in their lives. Urticaria is characterized by a round rash that itch skin intensity, and it may due to chemicals in certain foods, allergy to certain medications, insect stings, sunlight, and sometimes the cause is unknown as well. As per study as published in Indian Journal of Dermatology, Venereology, and Leprosy, more than one-fifth of the population suffer urticaria at one time. 60% of patients in the age group of 20 to 40 years, an incident is higher in older age group as well. Urticaria is classified as acute and chronic, but the most important part is to ignore it and not doing self medication can worsen its symptoms. Consult your nearby dermatologist and skin specialist immediately for an early vision. In today's digital world, it is a boon or blessing that we can get to hear from an expert dermatologist online about urticaria, about its type, how can we prevent it, and the kind of tests which are required for the diagnosis and the right treatment management approach for an earlier age. So, ladies and gentlemen, girls and boys, we have with us today renowned dermatologist of India, Dr. Meenal Mittal, who has over 10 years of experience as a dermatologist. She is a Bachelor of Medicine, Bachelor of Surgery, that is MBBS Medicine, MD Dermatology. Dr. Meenal Mittal is known for her command over the field and enjoys the reputation of being both skillful and ethical. Dr. Meenal, a very warm welcome in today's live.
Uh, Thank you, Sanya, for a warm introduction. And good morning, everyone. So today we are going to discuss about urticaria. Everyone has faced the episodes of urticaria. Most of the people have complaints of urticaria like wheals or hives, or we call them as pitti in common language. जो पित्ती की परेशानी है, जो पित्ती हो जाती है. There are so many factors that can lead to the aggravation and episodes of urticaria. One in five people have experienced an episode of urticaria once in a lifetime. So it is a common problem. Although it can be easily diagnosed, but it is very difficult to treat because sometimes it is very chronic. Also, it persists for a longer duration. Even after taking medications for a longer period, the episodes of urticaria keeps uh, recurring. So today we'll discuss about the different types of urticaria, their investigations, how to approach, when to approach a doctor, dermatologist if you have urticaria, and what all things you can manage if you have urticaria for a longer duration. So first of all, we'll discuss what is urticaria. Urticaria is development of wheals or hives. They are skin-colored or pale-colored swellings that develop after itching, usually after itching, and they are surrounded by erythema or redness sometimes. Sometimes wheals are also associated with angioedema. In wheals, there is superficial swellings, but in angioedema, there is a deeper swelling. Sometimes when people have episodes of urticaria, there is associated swelling around the oral cavity, around eyes, around other mucosal areas of the body, like genitalia, soft tissues. Um, uh, there are other areas also. There is associated swelling. That is called angioedema. When there is swelling of the deeper tissues of the body, it is called angioedema. And when there is superficial swelling, it is urticaria or urticarial rash, like hives or. So there are different types of urticaria, like depending on the duration. If the urticaria is present for less than 6 weeks, it is called acute urticaria. And if it is present for more than duration of more than 6 weeks, then it is called chronic urticaria. So it is important to rule out the co- differentiate between acute and chronic because there are different causes of acute urticaria and different causes of chronic urticaria. Acute urticaria is the most common cause in cases of acute urticaria is any infection like viral infection, bacterial or parasite infection. These all types of infections can precipitate acute urticaria. And other common causes of acute episodes of urticaria can be any drug allergy, can be allergy to any food item, can be insect bite allergy. There's any kind of allergies can precipitate acute episode of urticaria. In children, most common cause is infection, food allergy, and drug allergy. In children, the most common cause of urticaria. But in adults, the most common cause is the food allergens. The food allergens are the most common cause of acute urticaria in adult population. Um, Now, these are the various causes of acute urticaria. And then coming to chronic urticaria can, which persists for more than 6 weeks. Usually the rashes of chronic urticaria are more persistent, but they disappear within 24 hours. So, the most important feature of any kind of urticaria is the wheals or rashes. They persist, they fade away within 24 hours. So, and if the wheals or rashes of urticaria, if they're present for more than 24 hours, so it is important to rule out other conditions also, which may mimic the urticarial lesions. Like there is urticarial vasculitis, and there are so many conditions that can mimic urticaria. So the duration is very important. That in how much time the lesions of urticaria they go away or fade away. So I was discussing about the chronic form of urticaria. Here, the lesions are usually more persistent, but they also go away fade away in within a period of 24 hours. And the chronic urticaria has two types: the spontaneous one and the inducible. In the spontaneous one, there is no specific cause, but in inducible ones, there are specific or physical triggers that can precipitate the urticaria. Usually, in the inducible urticaria, the lesions appear after 5 to 10 minutes of the trigger, and they goes away within few hours. So, the various causes of inducible can be any physical trigger, any pressure urticaria, any cold or heat urticaria can be there, that is precipitated by cold temperature or hot temperature. Then there are solar urticaria also, which is precipitated by the exposure to sunlight for a longer duration. And there are other urticarias like cholinergic urticaria, which gets precipitated. The cholinergic urticaria is the one which gets precipitated on excessive sweating, or taking bath with very hot water, and after aggressive exercises. All these can precipitate cholinergic urticaria. But the cholinergic one, the urticaria, is usually different from the classical presentation, because here the wheels are very small in size as compared to the usual presentation of urticaria. They are multiple in number and they are very small in size, usually pale in color. Pale colored swellings appears all over the body or the area where there is excessive sweating or excessive exposure to heat, hot water. So these things can precipitate the cholinergic urticaria. Um, Now, there are other forms of uh, inducible urticaria also, like there is vibratory urticaria, then there is aquagenic urticaria, which is precipitated by water. Uh, uh, or there are different provocation tests available present for every kind of inducible urticaria, so that we can find the specific cause or of the inducible ones. Now, coming to the spontaneous ones, the spontaneous form of chronic urticaria, there is no particular cause in spontaneous form of urticaria, but about 0.5 to 2% of the total population experience the chronic spontaneous form of urticaria. Out of all the patients who have urticaria, 0.5 to 2% population they experience the chronic spontaneous type of urticaria, and there is no specific cause. And the there are some baseline factors that in which there are more chances of getting those patients have more chances of getting chronic spontaneous urticaria, like the patients who have any autoimmune conditions like SLE, vasculitis, like thyroid disorders, collagen disorders. All these patients have all these conditions in the baseline have are the factors that are associated with the chronic spontaneous type of urticaria. And the aggravatory factors that are responsible for this chronic spontaneous urticaria can be any food allergens, the preservatives in foods like azodyes, benzoates, any drug allergens, any infections. All these things can precipitate the chronic spontaneous type of urticaria. So this all we have discussed about the base, what is urticaria, the types of urticaria, and the main causes of urticaria. So, okay.
Yes, doctor, you have already told about the different types of urticaria, that is acute and chronic, and in that also they have like spontaneous and a different type of urticaria. Doctor, when we talk about the causes of urticaria, as you have already mentioned that there can be food allergies, there can be some type of sunlight exposure. So there are like types of urticaria, and the causes may differ. Is it like that the urticaria occurs in the younger age more than the older age? Is it like that?
Sorry, can you repeat the question?
Okay, so my question is that as you have already told us the causes of urticaria, there are different types of urticaria. So is it like that, at the younger age or at the teenage, the urticaria, the chances of urticaria are more, and in the older age it will be less, or it is not like that? The urticaria, it does not have any age bar.
No, there is no age bar. Urticaria can present in any age group, in the children's, in adult age group, in older age. It can the first episode can come in any age. It's not like that in children, if there is no complaint of urticaria in children or adult, the people will not have the first episode in older age. It is like there is no age bar for urticaria. The people can have first episode of urticaria or acute or chronic one at any age.
So at any age, there is no age bar for urticaria. And doctor, when we talk about urticaria, as you have already told us that it is, spontaneous, it is acute and chronic. So how a person can identify that this particular thing is urticaria and they need to consult to nearby dermatologist? Usually people self-medicate. They go to a medical store and ask, कि मुझे ऐसा राउंड रैश हो रहा है या इट्स इचिंग, तो आप कोई ऐसी दवाई दे दीजिए, तो उस पॉइंट ऑफ टाइम के लिए वो सही भी हो जाता है. सो इज इट राइट टू डू दैट, टू सेल्फ मेडिकेट, और कुछ होम रेमेडी कोई अप्लाई करता है, तो इज इट राइट टू डू दैट?
Actually, it is not right to use over the counter drugs available, because for a temporary relief you will get, but if there is chronic condition and if you will not get the proper medicine, then it can aggravate also. Sometimes for longer, if the patient have a complaint of urticaria for long duration, and he or she is not taking any medication, proper medications for the urticaria, then in afterwards he or she can experience episodes of angioedema also, when there is swelling around the eyes, around the lips. There is swelling of the deeper tissues, deeper dermis. So to prevent the accumulation of to prevent experiencing this attack of angioedema, it is important to take the medicines with proper consultation from a dermatologist on time. Meanwhile, if you have a problem and you cannot go to a doctor for 1 or 2 days, that in that time you can use calamine lotions. They are soothing lotions uh, uh, that you can use for a short period before going to a dermatologist. But for proper medications, you must visit a doctor and get a proper prescription. Although the medicines of the treatment of urticaria, it goes for a longer period. You may have to take medications until you have remission in your episodes, and in between remissions also sometimes we have to advise medications in between the episodes also, so that there is no aggravation of episodes. But for topical application for short period, you can use calming lotions that provide soothing effect for a for duration. And rest there are before before because it is important also because there are so many conditions that can be associated with urticaria. For that, there are investigations also like CBC, complete blood count, ESR, serum Ig levels, the thyroid associated conditions. So thyroid related investigations are very important. So all these can be prescribed by a doctor. Sometimes it is also associated with any kind of infection, the urine or intestinal infection. Also, these things can all should be ruled out. For these, the concerned investigations and the required investigations must be done. Like if there if we are suspecting any infection like parasitic infection, then stool test and other investigations must be done. Serum Ig levels must be done. If there are allergic conditions suspected, serum Ig levels must be done. And if there are any autoimmune conditions, the necessary investigations related to the autoimmune conditions should also be done. So usually in urticaria, there is like the two cells, the mast cells and the basophil cells, which release the hormone, the mediators like histamines and platelet aggregating factors, which leads to the stimulation of the sensory nerves, and this stimulation leads to the dilatation of the blood vessels and collection of fluid in the tissues. With this collection of tissues in the collection of fluid in the tissues, it leads to the swelling or the pale colored swelling or skin colored swellings we see usually in urticaria. And sometimes they're also surrounded by redness, red brim or erythema in the surrounding region. So if you are experiencing, if anyone is experiencing such episodes of beels or urticaria, so you must consult your dermatologist without wasting any time and get a proper treatment on time.
Yes, so if you're facing any such problem, you should definitely consult a dermatologist because, as doctor said, it is very important to consult a dermatologist as soon as you see that some kind of rash or itching is happening to you. Doctor, when we are talking about urticaria, what are the treatment options which are available for both the acute and the chronic urticaria, and how long the treatment usually goes for acute and chronic urticaria?
Usually, the first line treatment after investigations, we start. Usually, the first line treatment is antihistamine. The antihistamines are usually the ones which have lesser sedation and they have lesser anticholinergic effects. Those antihistamines, like cetirizine, levocetirizine, all these are the histamines, antihistamines that prevent release of histamines from the mast cells and basophils, and thus provide relief in the aggravation of the episodes of urticaria. Then there are first generation antihistamines also, which are more of sedating type, but that can be given in at night time because of their sedation effect, and and the non-sedating ones can be given at the daytime. So first line treatment is antihistamines, and if there are recurrent episodes, refractory uh, urticaria for long duration, acute or chronic type of refractory urticaria, then we can also combine with immunomodulatory drugs like steroids for shorter course, shorter duration. We can give small doses of corticosteroids also, and then we can also give other immunomodulators like azathioprine, cyclosporin in prescribed doses can be given. If there are chronic or acute refractory cases for a longer duration, then in recurrent cases we can combine with the immunomodulatory drugs. And otherwise, we can start with antihistamines. We can increase the dose. We can increase the dose up till there is relief in the symptoms, and there are biologicals also like omalizumab drug. It is in injectable forms. They are also given in severe cases of urticaria and in chronic cases of urticaria. The omalizumab biologicals are also given. subcutaneous injections of and there is before starting with medications, it is important to make a chart of the urticaria severity score. There is urticaria severity score, which determines the pruritus and symptoms of urticaria, and accordingly there are grades given to it. All these grades combined for 7 days, they provide the urticarial severity score of the patient, and with this score we can determine the exact dose and exact duration of medications that should be given to the patient. And
Okay, so that means there is a proper treatment of urticaria, be it acute or chronic. So if you're facing any such kind of issue, you must consult a dermatologist because there is a proper treatment which is available, and you should definitely take it. And doctor, now we have some live viewers question as well who are watching this live. So Akansha is here, and she's asking, what should not do when they have urticaria?
okay, you should if you have urticaria, you should not rub your lesions vigorously. Because of rubbing, you may also develop scratch marks, and it may also precipitate the scratch cycle, and you'll itch more, and it will precipitate your problem. So you should not rub your lesion. Meanwhile, if you are not going to a doctor, then meanwhile you can start using any moisturizing lotions or calamine lotions that will provide a soothing relief. And you can also do things like, if you are noticing something like any food allergy or any drug is precipitating the problem, you may maintain a diary of the allergens that you think that are precipitating your problems, like anything in food. Sometimes people have allergies to peanuts, the eggs, milk, various things. They have allergies to various things. So if you are finding anything that is precipitating the lesions, so you must note down. And when you visit your doctor, you must convey to him that these are the particular things that is precipitating a problem. These are the triggering factors. And if you notice anything like there is excessive heat after excessive exercises, vigorous exercises, or any hot water bath, or anything, you have experienced an episode of urticaria. So you all must note down everything and must convey to your doctor that these were the things that was precipitating my problem. These were the triggering factors. So he or she can advise you accordingly the how to manage the episodes and what all you can do at home, and besides taking medication.
Right, definitely. So you should note it down, right, doctor? That if I have peanut today, so my urticaria, it is as well, and I have developed some kind of urticaria. So noting down and telling your past history to the doctor is must, as doctor told us. Doctor, as sometimes the itchiness is more, and people scratch their hands due to urticaria. So we would really love to know, that is urticaria contagious? It can be passed from one person to another.
No, no. Urticaria is not at all contagious because it is an individual problem. It is not at all contagious. So, there is nothing like contagious, and it is a individual problem. It is not at all contagious.
Okay, so it is not contagious, and it cannot spread from one person to another. Doctor, we have another live viewer question. Firoz asking, how can I classify acute and chronic urticaria as my wife is suffering?
So acute and chronic urticaria, if the episodes of urticaria have started and they have gone on for continuing for 6 weeks, less than period of 6 weeks, then it is acute. And if they are more, if the duration of urticarial regions is more than 6 weeks, and then it is called chronic urticaria. Although there are different causes that are causing the acute urticaria and chronic urticaria, but the duration is less than 6 weeks, it is acute and urticaria, and if it is more than 6 weeks, it is called chronic.
Yes, so that's how you can identify acute and chronic urticaria. Doctor, as we are discussing about urticaria, and you have already told us about the various treatment options, Is there any dietary precaution one should definitely take if he or she is suffering from urticaria? And what are the do's and don'ts for the patients who are suffering for urticaria they must follow?
There is no particular diet plan. I discussed that you have to maintain a diet. Everyone has a specific should have a specific diet plan in which you should exclude all the things that you are precipitating your problem. You should maintain a diary that what all things are precipitating your urticarial lesion. You should maintain the diary, and you should exclude all those things from your diet. That and but there is no particular diet that everyone can follow. Everyone has an individual diet according to the precipitating food items or any allergens like dust, mites, any insect bite. Sometimes people, usually in children, they also have insect bite allergy. When there is after insect bite, they develop urticarial lesions all over the body, especially over the exposed parts like the arms and the legs. Those are the exposed parts. So they develop urticarial lesions there. That is called papillar urticaria. After insect bite, they develop the urticarial lesions. So there is no particular diet. You have to follow the diet according to the precipitating factors that are precipitating your lesions.
Okay, so it depends on person to person. Doctor, usually as monsoon season have already hit India, and usually we have seen, in monsoon there are so many insects which are around, and somebody go out and then they find out, their hand is itching or something like that is happening. So, what precautions somebody should take during the monsoon season to prevent the urticaria?
During monsoon season, because there is so much of humidity and so much of sweating. So usually, if you have a sweating or sweating as the precipitating factor, or you have cholinergic type of urticaria, which gets aggravated on excessive sweating or vigorous exercises, so you must avoid. You must take proper bath morning or evening, so that the excessive sweat or dirt from your body washes out, and thus prevents the episodes of urticaria. And during monsoon season, it is also to prevent insect breeding nearby. It is important to remove all the stagnant waters, what we call as the रुका हुआ पानी जो होता है, that should not be there in our surrounding area. So stagnant water नहीं होगा, so that will prevent the breeding of insects in the surrounding areas. So that all we can do in this monsoon season. And
so these are the precautions you must take in the monsoon season. Doctor, sometimes we have seen that many people have the problem of urticaria, but they do not treat it well. So, what are the potential complications related to urticaria if they are left untreated?
Okay. As discussed in starting, there is angioedema. When there is swelling in the deeper tissues or accumulation of fluid in the deeper tissues of the skin, the deeper layers of the skin, then there is development of angioedema. And sometimes in angioedema, there is swelling around the eyes, around the oral cavity, around the hands also. Sometimes there is swelling of the hands or feet also, and the genital areas also. There is sometimes swelling in angioedema, and sometimes swelling in the of the oral cavity is so severe that it may interfere with the breathing also. So if you have developed urticaria with swelling around the eyes or around the oral cavity, it is an emergency and you must consult the doctor immediately so that you can get a proper prescription for angioedema accordingly. Because angioedema is emergency in case of severe swelling. It can affect your food pipe and the wind pipe also. So there is difficulty in breathing. And sometimes there is anaphylactic shock that can be if there is angioedema for a longer duration, that can precipitate the anaphylactic shock, and that is emergency. So these are the complications that should be prevented by taking medications on time.
Right. So these are the possible complications which can occur if your urticaria is untreated. Doctor, we have another live viewer question. Who will be and asking, is diet play important role in curbing urticaria?
Okay. Diet has important role in precipitating also, and if you are following a proper diet plan according to the food allergens or any other allergens, uh, then it has got an importance in treatment also, because you can, if you have a proper diary of what all things like food allergens, dust, insect allergens, and sometimes the food that has preservatives like azotides, benzoates, all these, the preservatives have the allergic potential, and they the canned foods or processed foods we have, all these they have allergens which precipitate the or aggravate the lesions or the episodes of urticaria. So diet has got an important role, especially in the precipitation also, as well as the in the treatment of urticaria.
Okay, so as we have discussed that diet play a very important role, in curing urticaria and the cause of urticaria as well. Can stress cause urticaria, doctor? And how does the stress urticaria looks like? Is it look any different from the usual urticaria?
Sorry, actually there was a call, so I could not listen to it.
Okay, so I was asking that we were discussing about the food urticaria, that due to food, various types of intakes of food, urticaria happen. Does stress also cause urticaria? And how
Stress,
does the stress urticaria looks like? Is it different from the usual urticaria?
no, it is not different. It is the same urticaria, but stress is the stress-related urticaria. Like stress is the precipitating factors. If you already have urticaria, then episodes of stress or psychological stress, it can precipitate episodes of urticaria in the duration. Like there is, you have urticaria lesions. You have an episode of urticaria a few years back. Now there is any period of stress, then you can have experience urticarial episodes in that duration. So it is a precipitating factor, of course, but is stress urticaria is similar to the usual urticaria.
So that means that stress can be the percipient of the urticaria, but it does not look any different from the usual urticaria. Doctor, is there? It is like that. The urticaria makes somebody tired as well, and the day-to-day life activities are hindered because of the urticaria.
If there are severe episodes of urticarial lesion, there are many. Every day you have an episode of urticaria, or twice in a day you have an episode of urticaria. So these are debilitating conditions, and it can affect your quality of life and working efficiency. Also, all these things can affect your working efficiency.
Okay, so it can definitely decrease your work efficiency. Doctor, is it like that urticaria was at the nights, like they are more active, or the person who is having urticaria, the itching or the rash or the redness increases in the night? Is it like that?
No, there is no relation to the day and night or diurnal variation in urticaria. It's like any time you can get an episode of urticaria depending on the precipitating factor. There is no diurnal variation in the episodes of urticaria.
Okay. And doctor, when you were telling about the treatment options, you also mentioned some lab tests which were need to required. So why are the lab tests when somebody is having urticaria are required, and why it is needed?
So the lab tests in urticaria are important to rule out the basic baseline condition that is precipitating the factor, precipitating the lesions or episodes of urticaria. To rule out the cause, it is important to have lab diagnosis done.
So it was great to hear from you, Doctor. So before we end this live session, any giveaway or takeaway message for all our viewers who are watching this live today?
Okay, on urticaria, the most important take-home message is maintain a diary of all the food items or anything that is precipitating a problem, any physical cause, pressure, temperature. So maintain a diary. Consult your doctor on time without taking and should not go on and take an over-the-counter drugs and take a proper prescription. You may continue the medicines according to the doctor's advice, but but if you're taking it on its own, it may or may not benefit. But in longer duration, you may experience complications, possible complications of urticaria. So consult your doctor on time, maintain a diary, avoid triggering factors that may lead to the urticarial lesions, and avoid scratching or itching the lesions. May use calamine lotions or soothing lotions or moisturizing lotions in the duration when you have not visited the doctor yet. So all these are the important tips that you must follow for urticaria.
Definitely, doctor, and thank you so much, Dr. Meenal Mittal, for your valuable time. And it has been a very informative session for our viewers, and we really look forward for many such sessions in the coming time. And I'm sure that they will use this information to prevent themselves and their near and dear ones from getting urticaria. And now, if they know that if they see such symptoms, they don't have to self-medicate; they have to approach a nearby dermatologist. So, thank you so much for your valuable time, doctor.
Okay. Thank you so much for making part of this program. Thank you.
Thank you so much, doctor. And thank you so much to all our viewers for your participation in today's session. And to get latest updates on how to keep your skin healthy, do like and follow our Facebook page all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you to all and good day.